MEC of Health and Social Development, Dr. Norman Mabasa. Thank you very much for allowing me to interview you, sir.
Thank you, Mr.
Let's get right into it. The situation, there's been a lot of perceived controversy regarding alleged contradictions on the shortage of medicines. Can you please clear that for us?
I don't know of any controversy. The fact is that we have medicines, it's a new financial year. I'm not complaining at all, actually. As for vaccines, we have them in large quantities. I'm just worried about the quality of journalism, or what has journalism has become. Because I think that if I tell you something, and you go and re-engineer it to suit a certain objective, it can be very bad. We have medicines. We have medicines. We have the money for medicines. It's the beginning of the financial year. It's April now, so we do not have shortage of money. We do not have shortage of vaccines. I have never said it for anybody, and if anybody implied I said that, it's an issue that has to be looked at by all the powers that be to make sure that journalism starts reflecting the views as expressed.
Okay. Now, thank you very much, sir. On to the next questions. So there is no crisis at the department?
No, not at all. We do not have a crisis. I repeat, we do not have a crisis. If I hear anybody saying we have got a crisis, that person must come with me and show me where the crisis is.
Okay. Thank you very much. Then there is, because also one of the questions that that needed to be asked is that people, there's a perceived perception that taxpayers' money is not being it's not getting its worth in the department, especially on the health side.
Not according to the audit findings that we have and the results that we have. People must listen to the budget speech and hear what we have achieved. And I think that there will be a full report in my budget speech that we have achieved. And yes, of course, there are things that will happen without your knowledge. Those are always subject to investigation, whether that's at the bank, whether that's the police, or whether that's in education, whether that's in... But anywhere where you have people who are working for you, you must never have too much faith. Anything can happen.
Okay. Then, briefly, can you just briefly summarize the 40,000 that is allegedly needed for EMS upgrade? If
I don't have any facts around that. Sure.
Oh, okay. Then I can get that from at a later stage. Is the department? Where is the department? The biggest challenges of the department is there. Which areas do you think you are still lacking, and which areas have you shown the biggest improvement according to?
In the Department of Health, people are sick. We are dealing with the sick at the hospitals. Are they getting operations when they want them? Are the machines functional all the time? These are the challenges that are normal within the Department of Health. The Department of Health deals with the sick. That's our business. Our service mandate is to make the sick well. And of course, you have to train doctors. You have to train, give bursaries to students to study and become nurses and doctors, pharmacists, radiographers. Do we have enough? I don't think we do. And we do not have that. And you have a province with Musina Hospital is 100 years old. Places like Chiridini are more than 50 years old. O'Donnell Fraser, more than 50 years old. So you can imagine if it becomes an automatic challenge, like driving an old car. You know, once you are driving an old car, you must have problems. So these challenges are there, they are real. And that's why we have built more than 58 clinics in the past 5 years. And we are hoping to build many more. And the past year alone, we have built almost an all revitalized 10. So once you start having to build a clinic, it means there was no service in that community. And that we must appreciate as a challenge. So this is an automatic challenge. It's not something where you can say you have no challenge in the Department of Health. I think it's not only here, and let's not talk about Limpopo as if it's an isolated area in the province. We have heard of these challenges in Gauteng, in Eastern Cape, in Mpumalanga, Northwest. I mean, so the challenges that we have here are general, that we will see in any Department of Health, anywhere.
So you don't have province-specific challenges?
No, they're the same. They may just differ because maybe here you need a hospital, the other side they need clinics. But the issue is we have challenges in the province, which are the challenges that are prevalent everywhere in the country. And those that we need to solve as a province. It doesn't mean that when they are countrywide, we are removing our responsibility from solving the same problems. But I was just indicating that, hey, I wouldn't like to leave you with an impression that says Limpopo is the only province that has no hospitals. I don't want to leave you with that impression at all.
I understand.
Yeah.
In which areas do you think that the department is doing fairly well? In which areas?
You know what? I think we have improved in so many ways. Let me give you the standing of the province. This province has got the third lowest prevalence on HIV and AIDS. We are the third lowest. The lowest is Western Cape, followed by Northern Cape, and then ourselves. And therefore, the burden of HIV and AIDS is less here than it is anywhere else in the other 7 provinces that we have. That's the one thing that we will say we are doing very, very well. In fact, to be honest, we've been running fairly well with minimum resources. And in our hospitals, we are managing to intervene in so many areas. Of course, you do have a challenge in that we don't have a lot of specialists. Take Bembe, for example. It's an NHI district. It was in the Sunday Times, and I read it there, relying on that report, that says we do not have a pediatrician as part of our fight against infant mortality, child mortality under 5 years. So those sorts of things. But these are systemic issues that affect the province. I mean, there are issues where the province has got serious challenges, and we need to be able to say, do we have good managers in the province? Do we have reliable managers in our hospitals? Do we have reliable people to run our facilities? Not all of them are bad. You do have good ones and bad ones. And the idea is to how do we get the bad ones? Sometimes you get it through repeated complaints in the facility about ordinary things. That's how it happens. Okay. These are challenges. I shouldn't tell you that it's honky-dory here. And we're doing well as a healthcare. We are not somewhere where when you arrive and we are sick, you run away to Gauteng because you don't want to be touched in Limpopo. It can never appear like that. In healthcare, we are delivering. I was at Philadelphia Hospital 2 days, just last week. I can tell you that the state-of-the-art dental facility that is there, not to be seen. I haven't seen it in our public hospitals, in some of the advanced provinces that we have.
Then you're scheduled to deliver the budget speech.
Yes.
What would you say, if we were to sum it up, what would you say is the #1 priority for the department? With its capital budget.
We have concentrated on provision of medicine, the non-negotiables that the minister has talked about. You want to put it? I have it here.